Rabies is a virus of the Rhabdoviridae family and the RNA virus group. The nucleic acid type is linear single-stranded RNA. Rabies is enveloped. Rabies is not a retrovirus. Rabies is a negative-sense RNA virus with a single-stranded genome. Rabies is transferred primarily through animals, such as raccoons, coyotes, skunks, and bats. Common reservoirs are terrestrial reservoirs, insectivorous bats, and dogs. In order to contract rabies, one must interact with an infected animal who may or may not appear ill. Rabies enters the body into the muscle through an animal bite. Humans have known of the rabies virus since around 3500 BC. Signs and symptoms of rabies include weakness, fever, headache, tingling around the bite site, and discomfort. As rabies progresses, one may experience anxiety, confusion, agitation, delirium, abnormal behavior, hallucinations, or insomnia, symptoms of cerebral dysfunction. Although all of these signs and symptoms may not be present, the acute period for rabies lasts from 2 to 10 days, after which the disease becomes fatal. The incubation period for rabies is about 1 to 3 months, but may be less than a week or more than a year in extreme cases. Rabies comes from Asia and Africa. About 50,000 people have rabies right now, and 15 million people are receiving post-rabies treatment. Major rabies outbreaks occur in South America, Asia, and Africa, as you can tell on the map below.
Wound care includes irrigation with povidone iodine solution, cleansing, tetanus vaccine, and wound closure. Post-exposure vaccines include passive antibody and vaccine. Non-immunized use the RIG treatment. Emovax rabies vaccine, which is intramuscular for pre/post rabies, and human diploid cell vaccine. Also, Emogam rabies HT vaccine, which is infused at the site. It's intramuscular for post-rabies, and human rabies immune globulin. The mortality rate for the unvaccinated is 100%. In order to prevent rabies, get yourself vaccinated, avoid wild animals, get your pet vaccinated, and have your children vaccinated. The rabies vaccine was invented on July 6, 1885. Rabies affects the brain, spinal cord, and central nervous system. It causes diseases in the brain and death. It travels on afferent nerves sent from the spinal cord to the brain, replicating itself inside nerve cells. Rabies causes the death of nerve cells in encephalitic and paralytic forms. Rabies have been known since 3500 BC. The first written record was in the Codex of Ishnuna. In the late 1800s, owners of rabid dogs were fined heavily. At this time, rabies was lethal without medication and was not a biological weapon. The biosafety level is 3. Social actions that can influence the spread of disease include contact with raccoons, bats, skunks, coyotes, and foxes, not getting vaccinated, and travel to Asia and Africa. Rabies public health policy includes Texas state legislation saying that all canines and felines must receive a rabies vaccine before they reach 12 months of age or if/when they come into contact with a wild animal. Also, all people must avoid confrontation with wild animals. Since all treatment has been developed, minimal research will be done. Those in opposition to the plan may be those who do not wish to pay for the vaccine or are afraid of the pain and discomfort associated with the rabies vaccine. Those who require a reduced price on the vaccine may fill out an application. Those afraid of the vaccine itself may be sedated at an additional cost. Everyone must receive a rabies vaccine from their local healthcare provider. HEB Ready Clinic provides a vaccine for $25, which is 75% off the original cost. You can also see your family physician for family rates. All Texas citizens must attend a rabies seminar to ensure full preparedness in the face of a rabid animal.
Don't you just love your animal? How adorable. But sometimes they can act a little anxious. And if they start to hallucinate, then you might have a problem. But if they're foaming at the mouth, then you better get some help.
Hello, I'm Dr. Laura Bernstein. Is your animal moody, unapproachable, foaming at the mouth? If you've witnessed any of these symptoms in your household pet, we have a solution for you. A Rabies 2014 seminar is coming to your hometown.
My dog Spike was a very vicious dog. After the 2014 rabies seminar, my dog underwent a spiritual cleanse.
Don't get the rabies. Get your pet vaccinated today.